Hey, this is take two. Hopefully, this time doesn't have a baby bomb and can update this information. So, question I received was about how insulin is covered on Medicare, and very complicated topic, and you can go back and forth on many things. So, there's actually a government program that on certain plans, some types of insulin is covered at $35 and not subjected to the deductible or the donut hole. So let's take a look at some of these plans and see what we can offer. So, person asked me this question in Franklin, Mass. So what I did is I put in their specific 100 unit milliliter solution, 10 milliliter vials, and 3 vials per month in every month. So then we took a look at the zip code for Franklin, Mass. And you can choose where you get your prescription. So let's take a look at mail order, Walgreens, and CVS. And looks like I had them in, so I don't want to double count them. So there's the pharmacies. And what we're going to do is we're going to take a look at Part D. So first we're going to take a look at Medicare Part D plans. And this is numbers for the remainder of the year. So we have SilverScript's Aetna Medicare plan, $32 a month premium, and the total cost for retail pharmacy plus the premium cost is $151.60. Next up is WellCare, $14 premium, $197 is the cost for the remainder of the year. So let's just take a quick peek at the way the WellCare works one. View drugs and their costs. So you notice that WellCare has both of them as standard pharmacies, and this cost should be the same no matter where you go. So for September, October, November, December, it should be $35 a month to fill the Novolog. And if you notice the details of it, so we're too late in the year to do this, but it would be uniform throughout. So even if you reach the donut hole, you would still be paying the $35 a month for the insulin drugs. So let's go back and take another look. One thing to keep in mind is there's a couple different options for your insulin. So I'm doing the Novolog. And when I checked this beforehand, because I was curious why the United Healthcare option, that typically is very good. I was aware of their government program for United Healthcare for $35 throughout the year. They're actually drug that's in network is Humalog. So without being a pharmacist and knowing the details, the differences, which one versus the other. So a lot of these ones you'll see jump from 200, 400, and this is the annual cost, 400. And you'll see where the break even is, where we're going to be, all of a sudden it's not covered. 600. WellCare, and I don't want to spend an hour scrolling through for you, but you notice you start getting up to $1,000, $1,200, $1,300, and that just what this means to me is the plans just don't cover that specific one. So we'd have to go back and $4,000 for the AARP Saver Plus. But if we change that to Humalog, all of a sudden the AARP one would be in the top of the list. So it really depends on which drug you do and which formulary covers that as in network. So that's that. So there's nothing to really worry about if you're on insulin and you want to go the supplement in the Part D route in your county. There's plenty of choices. So we'd actually take a look at all the rest of the drugs and see and do this calculation for the rest of the drugs. But I just wanted to isolate that one insulin drug. So let's also take a look at a real quick look at Medicare Advantage. And I did this at a different county in Massachusetts earlier, and that's why I'm doing a take two, because the plan that was showing up as number one is not, unfortunately, is not available in this county. So if we take a look at, these are sorted lowest drug plus premium costs. Total drug and premium cost is $41.66 for the least expensive one. What that's telling me is none of these Advantage plans are covering Novolog. So yeah, Novolog is not on any of these. So that other plan I was showing you that would have been cheap is not available in your county. Just to real quick, let's remove that one and add the Humalog just to food for thought. Humalog, add the drug. So it's offering me a generic version of that, but let's just add the name brand just to keep it. So the 100 unit per milliliter solution, and then you said you take the 10 milliliter vial and 3 vials per month. So add that to the list. Done adding drugs. We already have the pharmacy in there, so that's done. And again, now we have the AARP United Healthcare plan. $140 is the estimated drug and premium cost for that, and that's $35 a month times 4 months. So even though there's a drug deductible, like I said, the government program has some certain insulin drugs on certain plans subsidized to the point where you're paying at most $35 per copay. And are there any others? United Healthcare, Fallon, Blue Cross, Healthy New England. I'm just going down until I see Tufts, because I know that the doctor's office you were talking about only takes Tufts. So Tufts apparently doesn't have any programs where they are subsidizing the. Sorry, I hope this isn't giving you a headache or getting you motion sickness scrolling this quickly. I have to go down to page 3 apparently. ARP. So no, I don't even see it. So the plan we're talking about apparently doesn't have that subsidy. So, all right, I hope this was helpful. Let's take a look at the overall costs and try and pick a plan that saves you the most amount of money. Have an awesome day. Bye.